Hi, welcome to season 2 of Real Nurse Stories. In this episode, I interview Sonia Goodwin. Sonia is a passionate nurse leader and also the CEO and founder of Sunny Street, which is a social enterprise organisation that Sonia set up along with a colleague of hers that started out as a service being provided from a car boot on the Sunshine Coast. Sonia is passionate about delivering pre-primary multi-generational healthcare for vulnerable people. She has a huge goal to extend the services that she currently provides so that they can be a national service one day. This is a fascinating journey into Sonia's nursing career and how she made the decision to jump, and her geronimo moment, as she calls it, and her journey into setting up her social enterprise. There are so many takeaways in this story, and for me, it just highlights how many avenues there are for nurses in terms of career progression and so many choices. So I hope you enjoy listening to this episode. I would love to hear your feedback. Enjoy listening. Hi, Sonia, and welcome to Real Nurse Stories. I'm thrilled to have the opportunity to interview you today, and I'm really grateful for you taking the time out to share your story today.
Yeah, thank you so much, Eva. It's just an honour to be here and to actually have the opportunity to share my story. So thank you so much for having this podcast platform. Wonderful.
You're welcome. You're welcome. So what I'd like to do, Sonia, is start right at the very beginning of your journey into nursing, if that's okay. And if you can just share a little bit about how you came to be a nurse, and, we'll start there. Okay.
Yeah, sure. So it was probably early to mid 1990s. I finished grade 12 in New South Wales and decided I thought either I would be a nurse or a teacher, which I think were probably very typical roles for women, young women to go into then. And so I secretly wanted to be an air hostess, but I kind of didn't tell anyone. So I applied. It was always the dream. However, I got into nursing, which was wonderful. So that was it in Lismore, down at the University of New England, Northern Rivers. I think it's called something very different now. And yeah, I absolutely loved it. I graduated and decided to move myself on my own from New South Wales to Queensland. So I would have been all of around 19 at the time. Specifically, what I loved, we went through emergency nursing, ICU, medical surgical wards, aged care, community. Specifically, what I loved was the aged care nursing, which isn't a popular choice. No. I think quite often emergency nursing and things like that are much more attractive and, fast paced. But for me, I feel like I've been a relationships nurse for a very long time. I've very much appreciated sitting with people in their space, holding space with someone and letting someone tell me their story. And just that connection that happens so beautifully in nursing. I found that with aged care, that was, there was great opportunity. So I moved to Queensland and started working up at Sandgate and in aged care. I graduated and went into aged care. I loved it. I have been an aged care and a community nurse for a long time. I have worked in the hospital systems and that's fantastic. But for me, the opportunity of community nursing, walking into someone's home, I quite often think of people's homes as little storybooks. And sometimes, it's decked out in the 70s decor and there's a little individual there also fitting that picture. And sometimes you walk into homes and they're modern and then there's someone who's dressed to the nines and I love it. So just the relationships. So I've been fortunate to work in areas I love. As I've gotten older, though, I've ended up working in, for the last decade, have worked in leadership roles in private and public health systems, which I've loved as well. Love leading. Management roles as well, and have also taught at the local university here on the Sunshine Coast. So as I've gotten older, I've preferred that leadership role and had great opportunity. And educating, the fact that I can teach other nurses how to care with very, very strong positive values, and try to be really real about the profession has been really important to me. And I guess I always personally wanted to work for a group that were very true to their vision and mission and values as well. So in the last, go back about 5 years ago, I started working in public health system in Queensland, and absolutely loved it. I was doing all kinds of things, leading different teams and working in education, and creating change has always been a very important thing to me, positive change for patient outcomes. And also to really lead with purpose with teams. I find that it's easier to manage people's purpose when you're leading a team rather than manage behaviours. If you can find out why another nurse is standing there in front of you and providing the care they're providing, then that's so much easier. So I was working in Queensland Health, loved it, primarily working in a role where I was in charge of around 30 nurses across 5 different hospitals. And what our role was to get people who were experiencing really complex discharges, that had complex care and really had difficulty getting home. So not your typical person who's really well supported. They have access to transport, finances, have a high degree of health literacy, and can go home. Very, very well linked into systems and family and people. That's always wonderful. But it's always great. But then there are the people that, the health has dramatically changed since they've come into hospital, and they perhaps don't have the support systems that others do. They may not even have family. They may not have a home. They may have really complex needs. They might also have issues with finances or live in poverty, mental health issues. There's a plethora of reasons that people find it difficult to get home or even have one. So our service across 5 hospitals, that was our job. We were all little problem solvers. Like solving puzzles, and so those nurses were dedicated and absolutely loved working with them. What I found though,
really, I like the way that you describe that as problem solvers, and it's like the bits of the jigsaw, isn't it, when you have a complex situation. Some people don't like that, but there's a lot of challenges in there, and it can be hugely rewarding to see all those pieces come together, and that enables that person to be able to leave hospital to wherever they're going with that support. But they're very challenging because of the complexity.
Very, very challenging. It's I think I definitely had a team of little problem solvers, and I think nurses inherently are innovative. And so sometimes there's there's some confines around that, but if like I said, if you can lead with purpose and find the purpose in why someone wants that difficult role, it is hard. It is hard to get people to find solutions where there aren't any in society for someone. So when we would get someone home who no other group could, or it looked like it wasn't going to happen, we would all celebrate. We would have lunch or high five and that kind of thing. So it was we did really good for someone. And so off to problem solve the next issue.
That's great. That's great.
Yeah. So one of the issues that we had great difficulty solving was watching people represent in emergency departments who consistently either had issues around mental health, unsupported mental health issues, drug addiction or use issues. Also, they had no home to go to. They had no support, no transport, limited health literacy. And these people consistently, hundreds and hundreds of people consistently coming through those doors. Unfortunately, emergency departments are not the place for, it's not appropriate care. They do amazing work, but not for people who need you to stop and really sit. So it was a massive gap, and one of my roles was to find a way to look at representations and find a solution, since we were all such great little problem solvers. That was a tough one. That's really, there's such a broad range of reasons. And at that stage, I met a friend of mine, Dr. Nova Evans, and she was also, tasked with getting people who had complex health care issues home. So we kind of joined forces as a team, which was really great, and we started to try and problem solve this. What happened was, it was difficult to create or find a solution in a system where there are perhaps at times innovation ceilings. So we tried to do what we could do, but we came up against issues consistently. And often working with older systems, it's difficult to bring in new processes. There's a lot of tape. There's a lot of all those kinds of wonderful things that happen in those services. And I guess that slowed it up a lot for us. But we could see the same people turning up to emergency departments, people trying to fall asleep in the emergency department so they could just get rest. And seeing their health deteriorate, and watch them easily every month come through. So one time there was a palliative care fundraiser, and for our wonderful palliative care team. And so, we thought we'll go along to that. So I went along with my friend, and it was essentially a networking meeting as well as a fundraiser. So at the end, there's wine and nibblies and all those wonderful things. The movie we watched was based on a doctor in India who saw an issue, a social issue, especially around palliative care. People were literally dying in the streets with no dignity, no pain relief, people with no support. And we watched this movie. What he did was he ended up creating a warehouse kind of situation, and he got volunteers to come in, nurses and other doctors, and they cared for people from the streets, took them in and provided dignified deaths. There was someone to hold their hand. There was someone, they didn't die alone. They died with less pain. And it was such a profound movie to watch. It was striking, and it really touched me. So in the at the end of this movie, he posed the question of, he asked the audience, are you really doing the best and the most you can for the people, for the most vulnerable people, for the people who need it most? And that's the question. And so the movie ended, and everyone left, and then I sat there with my friend, Dr. Nova Evans, and we just sat there. We were the only two left, and I said, I don't think we are. We're not reaching the people. We're seeing people coming back, and I don't think we're doing everything we truly can. At that stage, I realised that the working within the system was a huge barrier. So we went away. We decided to go away for a weekend, take our resumes, like the absolute nursing and doctor geeks we are. I mean, obviously, I know if you go away for a weekend, you take your resume. Sounds like a good weekend, doesn't it?
Yeah.
So we took our resumes, sat in different spaces in Brisbane for a whole 2 days, talked about our values, our working values, our strengths and weaknesses that we were aware of, how we would work together, and what would be what would we focus on? How would we best? Is it possible to create a solution? Are we brave enough to create a solution? Courage was a big conversation that weekend.
Yeah.
At that stage, we were both main breadwinners for both our families, and we have between both families 8 children and three grandchildren. So it was a big discussion. We also had permanent managerial roles, and all of my friends said, Sonia, do not think of leaving. It takes. Don't give up your day job. It's great remuneration, it's safe, it's everything you ever want, you know. I decided to not listen to that, all of that advice.
Yeah.
And the next day, I went to work along with Nova, and resigned from our public health sector roles as managers. Gave 5 weeks notice because I was responsible for a large team across a lot of hospitals, and I also loved the team, so I wanted to give them space to deal with everything, and decided to do something very different with my career. I didn't I didn't plan on doing that. I finally had the permanent role, and it was everything that I was meant to want. And it just, I think when you're looking at people coming through the system who need so much more, I guess I just couldn't sleep at night knowing that I saw it and I wasn't brave enough to do something about it. And that bravery means losing financial security. It means giving up a public health sector career. It means, I'd spent a decade working in leadership and management, all of those things. And taking massive risk and creating something that just simply doesn't exist in this entire region.
That's the when you think about health, and the definitions of health, it's always an issue, isn't it? That conversely, those that actually need the most help are often the ones that don't have access to the right support and help for their health. And I think, that it always astounds me that there is so much unmet need out there, and we just see the tip of the iceberg in health. And yet, as you say, there's this innovation ceiling, that there's so many barriers that are in the way, and that's not deliberate. It's just the way that we've structured health, that if you do have an innovative idea and you do want to try and do something different, it's just so painfully slow to try and do that. And I think the other thing that I really relate to, as you were talking there, was this whole don't give up your day job. I have a lot of conversations with a lot of nurses about, this being comfortable, in a job that you've got long service leave, you've got, super fund, all of those positives. But actually that in itself can stifle innovation, because people get comfortable. They don't want to lose that. And it again kind of stops that. I often think, if we didn't have those things, how much more innovation would we have? Because it would encourage that. It almost works against it in some ways. So I think
it does. And I've heard the concept of a salary and all of those, the lovely remuneration is a trade-off for giving up your dreams. And I I guess sitting at home, I thought I can stay in the role and I'm safe and I can do well, and it's pleasing to everyone, to be honest. It's very pleasing. And I guess I didn't, in the end, I suppose I didn't really care about being pleasing. I wondered, I thought, I have possibly 20 to 25 years left of my nursing career. What if I jump-started my vulnerability? What if I was brave enough to take a massive leap, get rid of the salary and help people who clearly need it? Like you say, it's the tip of an iceberg, but look, I think my grandmother taught me when I was younger that you just need one person to make a connection with you and make a difference. If there's one person that is the bridge that can't break for someone, that can change someone's life. So I wondered if I could create a service with my friend that could be the bridge that doesn't break for people who have had so many things taken away or broken. So that's why I left.
Sonia, how can I, sorry to interrupt you, can I just ask you, how did you feel at that moment when you made the decision, you'd gone in and you said, I'm resigning? How did you feel?
Well,
I'm curious.
It was funny because we were both sitting, Nova and I were both sitting at a table having coffee, and I said to her, we're going to do this. I have to do this. And she's, I have to do this too. I said, all right. And it was funny because she was deliberating a little, and I thought, I'm just going to go and do this. Otherwise, we're just going to sit here. And it's kind of like goals, you just need action. Wonderful. We can all write down goals, but not many of us act on it. It's a point of differentiation, isn't it? So I went upstairs and she came up as well, and she was talking to a nurse, and I sat there and I didn't say a word, but I opened my email and I just started typing, the email, and said I'd like to give 5 weeks notice. I was shaking as I wrote it because not one person said it was a good idea. Of all my people who are closest to me. And my hands were physically shaking, and then I pressed send, and I turned around and said, I just resigned. And I felt energized, and I felt if I don't back myself, then nothing happens. I think it takes one person or many people, if you can, easier if you go as a group, but one person to just decide and create action, and then from there incredible things happen. And that's what I did. I was shaking. I was not good at, I had all the advice to not do the thing, and then I did the thing. And I'm 48. The highest group of the highest group of people in the streets that are rising at the moment are women of 55 and over. So it was a massive decision for me in my mid-40s to decide, 10 years off that, to decide to give up a public health career with fantastic remuneration. But there's a hell of a lot more people braver than me making those decisions. So I took a chance, and it's been quite the journey since.
Because you described that as your Geronimo moment. That's why I was curious to know how you felt. Because when you're talking, it reminds me, you've probably seen that, the Simon Sinek Why. Have you ever seen that?
No.
Oh, it's a talk. I think it's a TED talk. If you put it into Google, you'll find it. Simon Sinek does this presentation about finding your why and following your passion. And it's when you were talking there, it talks about doing something that's important to you and the passion that drives that. And there's so many times I think in life where people try and drown that bit out, but it's so important to who you are. And it reminded me as you were talking there about, the finding your why, and the purpose and the meaning of finding your why is just reminded me of that when you were talking.
Yeah, it's definitely that, and I think that's part of it. I think if you can find it, but then the other part, the most important bit, is acting on it.
Yes, absolutely.
So sometimes we know what our why is, and we, there are a lot of people who have a lot of dreams and could create incredible innovation. The difference is action.
Yes.
And that's the Geronimo moments that you, when you're frightened and everything says don't do it, but there's something else in you that is calling for you to do that thing. That's a big moment. That's a massive Geronimo moment. I've had quite a few of those in the last 2.5 years since I began Sunny Street. So so we had for the first year, when I began, we started out of a car boot. So we decided to focus on homelessness out of all the things to change in the world, because I kind of thought, well, look, if I'm going to do this, I want to make a positive impact. Actually, in Australia, I don't want it to be small. I want it to really, really change the way we do things, because in so many aspects we need to in healthcare. I wasn't sure if I had the skills or bravery to do it, but in the last 2.5 years, I've proven to myself that I do. And I think as long as I focus on the result, then that's helpful. Every time I go to a clinic and sit with a patient, sit with someone who doesn't have anywhere to live, or there's no conversation, there's no support, there's no love or kindness in their life. If I ever doubt what I'm doing, all I have to do is sit there and go, everything we're doing matters. Every clinic we do saves lives. So decided to focus on homelessness because the second largest group at that time were children under the age of 25 in Australia experiencing homelessness. And because I have 4 children myself, I thought, it just really struck a chord with me. So I thought for the next 20-25 years, I could dedicate myself to trying to impact the healthcare and even the connection for people who haven't been heard and are typically stigmatized. So I started out of a car boot with a nurse's kit from my old community nursing days, and typed up the assessments, and they look really dodgy on a Word document, but I don't have great administration skills, clearly. But, we asked the questions, and it's been a huge learning curve. It has been a huge learning curve. And it's been something I've absolutely enjoyed the entire time. And my gosh, I'm really good at failing, and I'm really good at learning and innovating. I was saying the first year that you kind of have to, when there's so many mistakes you're making, and as long as you let the people lead you to find solutions, that's a really good barometer to have. So I definitely let patients and friends on the street, help guide. But for the first year, I was told that it was not a good idea. It doesn't exist, so how could I create it? I was told that it's not possible, or that particular person couldn't possibly do it, so therefore I couldn't. So what I did was I wrote, every time someone told me that it wasn't going to work, I wrote it down on my phone, and I titled it Motivation, so that I could look at that and push through. And I'm a bit of a rebellious character. So every time someone told me I couldn't do it, I thought I probably can. So I probably can.
It's like when someone says, no, you can't do it, it sometimes serves as the biggest motivator ever, doesn't it? Right.
Yeah, that's right. That's exactly what happened. So it was wonderful motivation. And I thought people probably speaking from their own experiences rather than me, what they see in me. I didn't know my own capacity, but I thought I was going to trust it anyway. So I still have that list. People don't tell me I can't do it anymore. They just ask me what's next.
Yeah. Yeah.
So yeah. But it was, it's been quite an incredible journey, and has absolutely changed my life in so many ways. And I'm so glad I geronimoed at that point. Yeah.
So you're tell me a little bit about, because it's what you've set up is a social enterprise, isn't it?
Yes.
Yeah.
Yes.
Because that's
Yes.
not easy either, is it? There's not that many social enterprises in Australia. I know from a lot of work I did in the UK in the community, there was a lot of social enterprise kind of momentum. This was back a few years, more than a few years ago now, but it almost supported the statutory services by encouraging social enterprise, but it's not something that you really see or hear a lot about here. So that in itself is a challenge, isn't it, to set that up?
It really is. It was a decision. We knew early. I knew that I had to get the business model correct. I actually thought this will be a charity, because we deal in people experiencing homelessness and vulnerable populations. It's going to be a charity. It lends its benevolent work.
Yeah.
However, had an interesting conversation a few years back, right at the beginning, when we were just kind of looking at what we're doing with Steve Baxter at River City Labs, and also his CEO, Peter Ellis. And I remember saying, we're going to set up a charity, and they both challenged, especially Peter, challenged that idea. Because I guess it's quite easy for women to create charities, and quite traditional, to do good work. And I guess it's easier perhaps to stand up in front of a charity and saying, this is a great thing, support this that we're doing. It's harder if you're not a charity, and you stand up and say, support me in doing this. It's a very, it makes you more vulnerable. The social enterprise concept, I decided not to go down the path of a charity. It's definitely easier to get money, for sure. We'd be doing things a lot quicker. But the world of social enterprise, essentially, where the company is a private company, where a percentage of your profits go back into assisting your mission, and to providing that benevolent care. I decided that would be the better way to go, because I guess it also gave our patients and our teams more say around the direction of the company, rather than having that governance board. We do have an advisory board, and they're amazing. But we really wanted the service to be led from the ground up. There were multiple reasons. There were also, around the charity space, issues around eligibility criteria. So essentially, we'd have to have a criteria to almost prove someone was vulnerable to access to service. And, I never wanted to stand there and ask a woman or a man if they're vulnerable enough to have a conversation about their life and their care. I don't think you can put a criteria on that, because if you say you're not homeless and you do have access to food and services, that could be a woman who is in a DV shelter. It can be anyone off the street, to be honest. It doesn't matter who turns up to see us, we are there. And so I guess we didn't want those constraints, but we also wanted to have that social responsibility. So we're answerable to our patients, our teams. Our advisory board also provide that assistance. But you're right, social enterprises are only new. And a very different kind of system, but the freedom around those systems to grow and create what we truly need, or what people truly need is much more accessible and profound.
And you're also leaving a legacy in that way, aren't you, as well, because of the engagement and the way that you've set that up, that almost continues, which from what you've said is your, you know, your vision and how you see it going forward, that it is an important part of your vision. So it makes sense that it would be a social enterprise as opposed to a charity.
Yes.
Yeah. How is what you do received by the people that you work with? How do they, because for them, where there's been nothing in that space, that must make a huge difference to have access to you and your
Do you mean
team.
patients?
Yeah.
Patients. We've had it was quite incredible when we first began in the first year. Our stakeholders, so groups like community centres that we work with, traditionally our model is that we head out typically in evenings and link in with a service that already has food, laundry, and provide a wraparound service for 2 hours, adding healthcare to that. We decided to go out to where people were at, meet people where they're at, because usually it's already, there's trust that has developed with local service providers and psychologically safe space, which was a fantastic way of starting. The stakeholders themselves, we have never, in the last 2.5 years, we've never had to look for a place to go and set up. In fact, there's a lot of groups that we just simply can't move that quickly and help. So we've had a lot of interest. It's important for us that our values align with the groups we work with, and where they haven't, we've removed the service, because we need to stay true to our values and our patients, and our reputation as well as a quality service. The stakeholders are interesting because we had certainly some people who, one chap who just started crying, got teary, because he said that, you know, for around 7 years, they've had people turning up with clinical issues and haven't had any, you know, healthcare support. And I remember actually, you know, leaving my number. He'd rung and I left my number, and he said, we've been working with them for 2.5 years now. He still has a Post-it note that has my number and name on it. Because he said it's just so needed. So our stakeholders, it works really well. Our patients, oh goodness, so mixed, and all incredibly positive. We had one woman who sat with us. We have a conversation-based model of healthcare, so it's not quite the typical. You don't go see a doctor or a nurse and that's it. We sit with people and meet them where they're at in their healthcare journey, and that could be anywhere. We can look at someone and they perhaps, you can see 10 to 20 things that, you know, you need to sort out. But really it's what's initially
important to them.
So that's the model that we've created, and that we work from, and it's a beautiful connecting model, where healthcare professionals take time to hold space with people and listen. We had one lady who, you know, we sat with her, and she was in tears. She said she hadn't talked or felt heard for 30 years. And so, you know, obviously then, you know, we were in tears too. We've had people, I think we had, there's been several people who have died on the beaches up here, you know, quite unknown, just infections, you know, around flu season, things like that. So just little things like, you know, providing antibiotics to people who are making the decision around purchasing antibiotics or food, or feeding their daughter versus antibiotics, or you know, the people just dying from infection because they can't financially access it's something as simple and as antibiotics, or they can't get a script. We found it just so much more creating access for people by going to where they're at. was so much better than creating another four walls for people to come to. It's difficult for people to access GP centres and mainstream healthcare because of health literacy issues. They can't write on the form. There isn't often the time to assist with that. They need to sit quietly in a space until their name is called, especially when there's anxiety or behavioural issues. And then, of course, the time constraints, which is not the fault of GPs. It's our Medicare billing system. It's time-based rather than outcome-based, which is horrible. So, we would like to change that and rally to change that too. So, to actually have a space where people could come and sit was profound. We also pay for people's medications if they're making those tough choices. We just trying to break down every barrier to give people the healthcare they need. We weren't initially sure whether the uptake would go well. Our first clinic was an event because why not? We can't do things in halves, more geronimo. And so we thought, look, I had 5 nurses, there were 2 doctors, there were 13 nursing students, and I thought, oh my goodness, we'd not done a thing before, and so we had a little scrum before and said, look, as long as people might not approach us, they don't know us, so maybe even if we can have a conversation about what we're doing, and start to establish that trust. But in those 4 hours, we saw 48 people, and it was a frenzy. It was people really wanting to understand their healthcare, people wanting to understand their medications, people wanting to understand implications of certain lifestyle actions. It has been profound. So we have people, patients who have just been sit with us and then just they're in tears because someone's just sitting and listening. It sounds, we've obviously missed the boat, so we're trying to impact, that I guess it's pre-primary healthcare, creating a pre-primary healthcare system for vulnerable people in Australia, so that they're not hitting emergency centres, so they aren't dying on the beaches, so that they do have access and their children have access as well to, a healthcare, so we can affect a multi-generational healthcare.
How is what you're doing, Sonia, being received by the health services generally? Is there collaboration there? Are they open to that in terms of, I know you have a goal to expand this much more, and I just wonder how you manage that interface, because the work that you're doing is really valuable in the sense that, again, as you're talking, I'm just thinking, to be able to give people an opportunity to understand a conversation-based health assessment in itself is a massive shift, because in a very tick-boxy world, that what you're essentially doing is giving someone the time and the space, and that's not something that, for all the reasons, health isn't always configured to do that. So there's massive learning opportunities from the work you're doing for other nurses and health professionals, but I also wonder kind of about that interface with health and whether they're recognising the impact that you're having around that.
Yeah, I'll address both those points. You're very right around the model being quite different, and having that time and space. I've certainly, when I first began, I just wanted to get in and assess someone and provide interventions, evaluation. We're brilliant. Nurses are brilliant at all of those things. We're taught well, and we're taught within the confines of time and funding. But I guess the conversational-based healthcare model that we have encourages people to take that time, but also to have. I really also wanted to draw out the innovative spirit and minds of nurses. So essentially, I'm working with a team of problem solvers again, around really, great complex health issues that haven't been perhaps touched for 30 to 40 years. It is very different. And I've had quite senior nurses have said to me, did you find that transition difficult to go from very clinical, I can see what needs to change for you, to just stopping and holding space with someone and taking time. And it is a big shift. You don't realise, but it's a massive shift. And a beautiful shift, and it needs to happen. We've also got nursing students from several universities, social work students, occupational therapist students, and medical students that are part of our system. And we take those wonderful students on board to try and mess with the minds of the young, to really look at a person. We say patient-centered a lot, but truly, meeting someone where they're at in their health journey. So we love that opportunity. We had an opportunity to be keynote speakers with AMSA, the Australian, it's a medical student association, and we spoke about love and kindness and time and pace in healthcare. And we had one chap, he just finished his medical degree that year, and he wrote to us and said, that's the first time I've heard kindness being mentioned in healthcare as a philosophy. So it's something that I'm really passionate about, and as a nurse leader, if I can show that way, then obviously and ask people to give themselves, other nurses, to give themselves permission to lean into someone else's space and become vulnerable as well. That's important. Around other healthcare groups, it's actually been, I guess, it's actually been very positive. We had to be very careful at the beginning to not set up a service that fractured care. Because we initially were seeing people on the streets, and some people had doctors. So we had to be very careful and watch our communication and say, we've just seen, communicate with that service. So we actually have some great relationships between GP centres along the coast. We also have GP centres who contact us and ask us to see, to catch someone if they can't quite catch them. We also have the beauty of so many volunteers and team members, nurses and doctors and paramedics in Sunny Street, is that quite often they're working in the hospitals that our patients turn up to. So we have this great advocacy all of a sudden, where typically in a hospital situation, if you've got someone who's homeless and drug taking and, showing these behaviours who are typically, problematic, and they take more time, we have a little system where we ask the patient if they're okay with any Sunny Streeters, making contact with them. And so what has been happening is having that advocacy in hospital, where you've got someone who, a Sunny Street doctor or nurse, who then says, I know this person. And all of a sudden they have an advocate, and they have someone who knows the history. It's been profound. But yes, we've had around 5 hospitals across Brisbane who have asked us to come and speak to their emergency departments about the opportunities around discharging people who experience homelessness, who don't have a GP. GP practices, we haven't had any great concerns with in any way. And also local councils are very aware of what we do. And if someone's being discharged into bushland after a hospital admission, then we get the call to see if we can go and check on them next to the creek up at Noosa or wherever.
That's great, because that's almost full circle, isn't it, from where that idea and that, the insight into what can we do to make a difference, and you've gone and you've set this up, but it's kind of coming back round in that they're working with you, which is testament to your hard work, really. But that must be really rewarding for you to hear and see that happen.
It's sometimes a bit pinch worthy. It's and also to have the validation from large health services to say, actually, we need help. There isn't
yeah,
a solution, and we think you're it. So we've had, you know, one particular hospital very keen and working with us on you know, discharge pathways
yeah,
for vulnerable people. It's just the tip of the iceberg in relation to the collaboration between health services, and actually the service that I've created, Sunny Street, is very is an integral part of that entire cycle, circle, yeah. So it's it's quite validating, and I can't believe it was 2.5 years ago that I geronimoed out of the public health sector to create a service that is now you know, being reached out. We've got even my old team you know, have made the call and said, look, where are you guys, because we've got this complex patient. And so I'm like, hi, this way.
Great. That's great. And I know, Sonia, that you've got a goal, a huge goal, to take this even further, haven't you? Tell me a little bit about your goal.
So as I said, we started out of a car boot in Maroochydore, Sunshine Coast. We run 12 clinics a week across Queensland. So we're up at Hervey Bay, Maryborough, we're Gympie, a lot on the Sunshine Coast, Brisbane Central, and the Fortitude Valley, and also the Gold Coast. My vision is that it's had such profound success and impact in people's health, that I want to see, and I want to push for the Sunny Street service to be the first nationally coordinated healthcare system for vulnerable people in Australia, so that people living in poverty, which is around 1.2 million people in Australia, and you know, nearly 800,000 of those people are children, have equitable access to healthcare when and where they need it, and then regardless of their barriers. So I've given myself 20 to 25 years to do that. It's just something I'm going to do outside my day job. And also, to be honest,
it's funny because I'm doing a lot of work at the moment around kind of taking my business forward, and one of the things I keep hearing is that your vision should scare you, you know, because if it's not scary enough, it's not big enough. And I just think, you know, that's it's a fantastic goal to have. And you know, I've no doubt, Sonia, your determination and how you've got so far in what's relatively a short period of time. You know, it's I have no doubt that you will, you know, get there. It's fabulous to hear. But I wonder, you know, in terms of getting there, that's going to require probably some partnership working to take you to that next step. And is that something that you're working on at the moment, or you have connections with people who can help you to realize that goal, actually, because it's a hugely important goal?
It is an important goal. After probably the first week after I resigned, I started writing the policies and procedures for the service based on a national model. You know,
so that was there then at the beginning.
If we're going to do this, we're just going to do this. It's not going to be something that sits in a backyard. But I wanted to try and impact Australia's backyard. The partnerships, in the first 10 months of beginning, we had different areas, different groups in Melbourne, in Sydney, like Newcastle, Geelong, Adelaide, Brisbane, the Gold Coast, Townsville, a lot of areas across Australia reaching out and saying, we need this here now. I made the decision to not expand in those years, obviously, because, you know, it would be great for footprints and all those things, but we're talking about healthcare, and, you know, which is, yeah, we're talking about healthcare, and the foundations, getting the foundations under a healthcare system is vital. So regardless of the outcry, the positive outcry, for Sunny Street to go national very quickly, we just couldn't. We have a database that has collected the doctors, the nurses, the community groups, all of those people, you know, who want us, have wanted us for 2 years to expand. We've been working and looking. Expansion is a huge issue, and it requires careful planning. It requires sustainability plans, culture, looking at our culture. You know, that's very important to us, our model, that doesn't fracture. So it's a lot of planning. We will absolutely get there in the next couple of years. But yeah, it's the partnerships. We've got a couple of partnerships that are already have national reach, which is beautiful, and everyone's just kind of sitting in the wings and waiting. And we sent out our recently we've sent out our survey again, our yearly survey, and to our stakeholders, and, you know, we say, is there any way we can improve the service? And, you know, for the last 2 years running consistently, the feedback has been expand sustainably, get this out there, more nurses, more doctors, it's needed. So I don't perceive any great issue around that, and the partnerships. We've been working hard for 2 years to try and make a sustainable service in this region, meaning Queensland, because yeah, why not think big? But yeah, so going national, yeah, it's inevitable. We're also looking at, we're in planning around in the next couple of months creating the first Sunny Street Centre on the Sunshine Coast, because we realised that we actually need that to close the gap around clinical governance, so that people have a place to go to get more comprehensive healthcare from us. So we also plan to run those across Australia as well.
And I guess sustainability is a big thing in terms of what we talked about earlier, in, you know, kind of, you want it to be set up in the right way to leave a legacy, and sometimes the rushing to expand is not always a good thing, is it? You know, once you have the model and you know that it works and you've got that and it's very clear, then that becomes easier to extend that out. But I guess the need for those services is driving that, you know, inquiry and that people wanting to be involved, which is a positive, because it's saying this is doable. It's when it's doable that's the issue, isn't it? Not
and
you know.
That's right.
Yeah,
not when I just have to make sure that I set that pace, rather than have the rest of the country set it.
A couple of last things that I want to ask you, because your journey and your story is fascinating, and I think, you know, one of the things you said about nurses are good at, you know, managing and problem solving, and normally I would ask a question about, you know, what advice would you give to a younger nurse, but I'm not going to ask you that question. I want to ask you, what advice would you give to a nurse who's listening to this and thinking, I've got a fantastic idea, it's something that I really want to develop, and thinking about making that leap?
Yeah. What advice would I give? The advice I would give would be, if it was based on me, I'd Geronimo. I forced myself into the role. There's a lot more sensible people than me. I think it's very important to get outside of the healthcare sector when you're looking at a new idea. Originally, when the whole concept of Sunny Street, I did not remain in the healthcare sector with the idea. I would give someone the advice to not remain or rely on the opinions or knowledge of people only in the healthcare sector. Certainly ask the questions. But there's also limitations within systems you're already working in. Yeah. So for me, I would suggest, which is exactly what I did, which was so incredibly beneficial, was talk to people in the healthcare sector, and people who have an entrepreneurial streak or spirit, who can give you critical advice, kind of like, I think Brené Brown calls them the square squad, where, people, you don't want people who are going to say, oh, you're fantastic, or people who go, this completely never going to work. You want someone in between who goes, great idea, but what about this? Yeah. So if you have a square squad there in healthcare, they're the people to talk to. Also to look at the entrepreneurial space. That's why I went to River City Labs and met Steve Baxter and Peter Ellis, and incredible entrepreneurs who were problem solvers, who thought outside the box, who pushed the boundaries with things. And, you need to be sitting amongst people who think like that. It doesn't matter if they're in data. It doesn't matter if they're what their product or service is. You need to be able to think with someone sit with someone and think and see how, be influenced by the entrepreneurial values and thought processes. That was very important for me. And the third, for me, being a female, I also started to reach into those female or feminist spaces, because as a woman, there's greater difficulty around pushing yourself out into a space as a CEO, where there's consistently a question around whether there's a male director behind you or someone helping you. So those three areas, if you're female, sorry, for the third one. So in healthcare, look for your square squad. People are going to give you, who are going to challenge you, but not in a negative way. Look at entrepreneurial spaces and go and sit amongst it, immerse yourself in it, that challenge you. I just think that I think also reading is probably one of those things that has kept me very resilient. So reading motivational books, reading people who have gone out and made a decision and taken a chance, and because resilience is so incredibly important. If you don't have that level of passion, or because it gets tough, it gets so tough, and if you don't truly believe and have a direct vision on your impact, on what your product or service's impact will be, it's easy to get toppled over. So anything that helps build your resilience.
And that was you've just led very nicely into my last question, which was to ask you how, because you've got such an energy, literally a can-do positive energy, and I wonder how you balance that, Sonia, for you in terms of the whole resilience and recharging your batteries, because it's not an easy undertaking setting a business up by it just that in itself is hard, but you've also working in a space where it is challenging. There's nothing really, or there wasn't anything there, that compounds that. And I just wonder, how do you protect your resilience so that you can keep driving forward to achieving your goal?
I think I'm very rebellious. I don't mind a challenge. So for me, if there's an issue, it's often seen as a challenge. So my perspective on what a problem is is helpful to me. I usually think there's probably a way to get around it. There's probably a solution. I think understanding, looking at that, understanding whether I have control or influence in a situation. If I have neither of those things, I don't spend my time in that space. I'm very protective of my energy, and my energy meaning the time outside of work as well. So I'm very deliberate with my time outside of work with people, and who those people are, because those people that I spend my time with will influence me greatly. I spend a lot of time on my hammock doing nothing. I don't do anything.
Great. I love hammocks. They're great.
I know. I think it's very soothing, the whole rocking. And, honestly, for years I have the quiet time, because I live because there's a lot of pressure on me in the role, and I do the social media, I do the operational component, less clinical than I used to now. So many human resource management, all of those areas are my role, and more, so much more. So I need the stillness. So stillness is really important for me, and also I guess having mentors, and those mentors can be other entrepreneurs who did great things, who just geronimoed, who took action, and I think it's also just turning up to clinics and sitting in the gutter with someone who wants a conversation, and I can't deny that. I sit there, and I can't stop this. It makes such a positive impact. There was one evening I was meant to go to the theatre with my family, and I had a nurse who called in sick, and so I thought, oh well, I'll go, because the group that we were working with were for children. So quite often our youngest patient has been about 2 weeks old, but typically do see 8-year-old and 8 to 18-year-old children. So I thought, oh, I can't let that go. So my family went to the theatre, and I thought, oh, is it a sign that I have theatre tickets, and I shouldn't go? And then I thought, oh, I don't have a nursing kit. Oh, that's definitely a sign, and then I thought, oh, stuff for signs. I'm going to go. That's the rebel in me again. So I drove to Brisbane. So I drove for 40 minutes and turned up with absolutely nothing but my conversation skills. But it was the most profound night. I sat with someone who had experienced serious sexual trauma for most of her life. She was just travelling through from the Gold Coast, and had not shared that with anyone. And it just happened that I was sitting there that evening when she came through, and so I sat with her and talked with her, and we looked at different supports and things, but to share that space, it was heartbreaking, and it was just fortunate that I was sitting there listening. And also had someone else, lovely girl, turn up who wanted to end her life. And so I sat with her, and we worked through that. We called the ambulance, and off she went, and contacted her the next day. She's okay. So I went outside to leave. It was the end of the clinic, and there was a chap sitting in the gutter. He was too old to go into the children's clinic, so sitting outside and needed food. So I, asked him, I got him some food, and then sat with him in the gutter, and we just talked about his life. He was sitting in the gutter with a black eye, and he was holding ice to it. He'd just gotten out of the watch house. And he had been a city planner previously, had multiple degrees, which is quite often what we find. People are, can be really well educated, and, there's just events that happen that just cause, the situation to be as it is for people, which which really means it can be any of us in a situation. So we talked about his life and how he got to where he is now, and then we sat down and tried to figure out where best he could sleep, where would be safest, and where to put his money. We found a really good spot in his shoe, and a really good place, fairly central, that had really good security cameras, which is just how kids sleep on the streets too. Normally, we grew up in beds, and we could hear our parents in the lounge room talking or walking, and it was so comforting. But so many of the children that we see haven't had that, and they don't have it, and they're comforted by the eye of a security camera instead. So that was the clinic I attended, with no bag, with every reason to not go. And I think that's what motivates me. That's what gives me resilience, knowing that the positive impact is profound. There's not one clinic that we do that doesn't save a life, will make a positive impact, and quite often we don't know what that positive impact is. So there's lots of things that help me be resilient, like time on my own, space, peace, reading about other people's incredible work and bravery it takes to do something big. But also it is just sitting in spaces and living that truth, and knowing that that's exactly why we're doing what we're doing. And that always is at the forefront of my mind, because as soon as it's just not good enough that I'm tired, or at times, or that I can't find the solution, or I don't know where the next lot of money is coming from, or it doesn't matter, it's just tough. I just have to find solutions, and be quite resilient, and make sure I take care of myself by having really good strategies around me. Burnout is very real for founders, as well as healthcare professionals dealing with trauma, but also for founders, because it's your business. It's something you're passionate about. Passion takes energy, but passion also gives you energy. So
and I think holding that space for someone and listening to their story, it actually is hard work, mentally hard work. It's not physical work, but it's that whole being in that space. And as you said at the beginning, being vulnerable, allowing yourself to be vulnerable and to listen, it's mentally exhausting. So to have that balance of peace and quietness, it is what allows you to do what you do really well. So it's hugely important. If people want to know more about the great work that you do, Sonia, where can they find out more about you?
So we have a website, which is sunnystreet.org. However, we're very active on Facebook and Instagram. So you can definitely see all the good work we're doing there. And there's email addresses on the website, or you can message on Facebook or Instagram. I'm also on LinkedIn as Nurse Sonia Goodwin, because I'm a very proud nurse leader. And so I have to put the title nurse in there. So Nurse Sonia Goodwin, happy for you to link in and have a conversation. It's, and if you're out there thinking of taking that leap, or having a Geronimo moment of your own, or starting your own vulnerability, then please connect. I'd be happy to talk and to give you some, advice if you needed it, and share my experience. So, we're all in this together, and you need a good squad and tribe beside you.
Absolutely. Sonia, it's been a real pleasure today to listen to your story, and to, just your passion and your enthusiasm and your motivation is just something that I think is very inspiring to others who, may be thinking about stepping out and into that entrepreneurial space, whatever that might be. And I really wish you every success with achieving your goal. I've no doubt you're going to do it, and maybe we have to have a Sonia part 2.
Yeah, that's right. You'll see the Sunny Street pink and yellow everywhere. Across the nation. Why not?
Yeah, definitely.
Yeah.
Thank you for your time today. I really appreciate that. So thank you.
Yeah, and thank you for giving me a platform to speak, but also advocating for nurses. It's
Yeah,
something that's close to my heart that you're doing. We need more of our voices out there.
yeah,
And holding hands together and moving
yeah,
healthcare forward into the future.
yeah.
So thank you for providing that and giving me time.
No, you're very welcome. You're very welcome.